Hey everyone, and welcome back to the channel. Today, we're diving into a topic that might seem a little personal, but it's incredibly important for understanding your health. We're talking about urine, and specifically, what its color can tell you about what's going on inside your body. It's like a built-in diagnostic tool that you can check every single day, for free. So, let's get right into it and decode the messages your body is sending you. First, let's establish a baseline. The ideal, gold standard color for your urine is a pale, straw-like yellow. Think of the color of lemonade. This shade is a fantastic sign. It generally means you are well hydrated and your kidneys are doing a great job filtering out waste products without being overworked. When you see this color, give yourself a pat on the back. You're likely drinking enough water and your body is in a state of happy balance. It's the color we should all be aiming for most of the time. Now, what if your urine is completely clear, like water? You might think this is the ultimate sign of hydration, but not necessarily. While it's usually not a major cause for concern, consistently clear urine could mean you're drinking too much water. Yes, there is such a thing. Overhydrating can dilute the electrolytes in your body, like sodium, leading to a potentially dangerous imbalance. It's rare, but it's something to be aware of. If your pee is always clear, you might want to slightly reduce your fluid intake and see if it returns to that healthy pale yellow. Let's move along the spectrum to a slightly more pigmented shade, a transparent, bright yellow. This is also perfectly normal and healthy. It's very similar to the pale straw color and just indicates that you are well hydrated. There's no need to change anything if this is your typical color. It shows that your system is functioning as it should be. Keep up whatever you're doing because your body is clearly happy with your hydration habits. Now we're getting into the shades that serve as a gentle nudge from your body. If you notice your urine is a dark yellow, it's a classic sign of mild dehydration. Your body is telling you, hey, I could use a little more water. This color means your urine is more concentrated with waste products because there isn't enough water to dilute them. It's not a reason to panic, but it is a clear signal to start sipping on some water. Try to drink a glass or two over the next hour and you should see the color lighten up. Moving on to an even darker shade, amber or honey-colored. This is a definite sign of dehydration. Your body is now sending a stronger message that it needs fluids, and soon. You might notice this color first thing in the morning, which is normal since you haven't been drinking overnight. However, if you're seeing this color throughout the day, it's time to take your water intake seriously. Dehydration can lead to headaches, fatigue, and brain fog. So, when you see amber, make reaching for your water bottle a top priority. What if your urine looks almost brown, like a dark syrup or cola? This can be a sign of severe dehydration. But it can also point to something more serious, like liver disease. Certain conditions such as rhabdomyolysis, which involves muscle breakdown, can also release substances that turn urine dark brown. If you're well hydrated and your urine is still this color, it's absolutely essential to contact your doctor right away to rule out any underlying medical issues. Don't wait on this one. Now, let's talk about some more unusual colors. If you see orange urine, take a moment to think. Have you recently started taking new medications, like high-dose B vitamins or certain antibiotics? Some of these can turn your urine a vibrant orange. It could also be a sign of dehydration. However, persistent orange urine can also indicate a problem with your liver or bile duct. If it doesn't go away after you rehydrate and you can't unlink it to a new medication or supplement, it's wise to get it checked out by a healthcare professional. Seeing red or pink in the toilet bowl can be alarming, and for good reason. First, consider your diet. Have you eaten a lot of beets, blackberries, or rhubarb recently? These foods contain natural pigments that can temporarily turn your urine pink or red. This is harmless and is often called beeturia. However, if you haven't eaten any of those foods, pink or red urine can signify blood, a condition known as hematuria. This could be caused by a range of issues from a simple urinary tract infection or kidney stones to more serious conditions. Any unexplained red or pink urine warrants an immediate visit to your doctor. What about even darker shades, like a deep red or purplish color? This is a very serious sign. It could indicate significant bleeding somewhere in your urinary tract, or be linked to a rare genetic condition called porphyria, which affects the production of heme, a component of your red blood cells. Dark red urine is a medical red flag. It's not something to observe or wait on. You should seek urgent medical attention to determine the cause. Let's move on to some even more uncommon colors. Have you ever heard of blue or green urine? It's real, but it's very rare. Often, it's caused by dyes used in foods or in medications for conditions like depression or allergies. It can also be a side effect of certain medical tests performed on the kidneys or bladder. In very rare cases, a genetic condition called familial hypercalcemia can cause blue urine. While it's usually harmless and linked to something you've ingested, if it's a surprise, it's always best to check with your doctor. Finally, what does it mean if your urine is cloudy or milky looking? This can sometimes be a sign of a urinary tract infection, as it might contain pus or white blood cells. It can also be a sign of kidney stones, which can cause minerals to crystallize in the urine, giving it a cloudy appearance. If you have cloudy urine accompanied by pain, a frequent urge to urinate, or a fever, you should see a doctor promptly. Sometimes it can just be from a diet high in phosphates like milk and cheese, but it's important to rule out infection. So to recap, that pale lemonade-like yellow is your goal. It's the sweet spot for hydration and health. Remember that diet, medications, and your fluid intake play a huge role in the color of your urine. This daily check is one of the simplest ways to monitor your health. Your body is constantly communicating with you, and learning to understand these signals is a powerful step toward taking control of your well-being. Thank you so much for tuning in today. I hope this guide helps you feel more informed and empowered. If you found this video helpful, please give it a thumbs up. And don't forget to subscribe and hit that notification bell so you don't miss any of our future health and wellness content. Stay hydrated, stay healthy, and see you in the next video.
Thanks for watching. Like, comments, and share.